So in last video, it was about the stimuli and the response of a cell, how a cell responds. The cell was responding by cellular adaptations like hypertrophy, hyperplasia, atrophy, metaplasia, or dysplasia. But what happens if these adaptations fail? If the cell is failing to adapt, then it will undergo cellular injury. This is called cell injury. How the cell injury occur? What is what are the stimuli for a cell injury? So we call them injurious stimuli. These stimuli, this is a cell. They they may be physical, chemical, biological, immunological, any virus, bacteria, temperature, toxins. There are n number of causes. Out of that, the most common cause of your cell injury is hypoxia. Most common is hypoxia. So we'll discuss what is hypoxia. Hypoxia is hypo means low and oxia is oxygen. It means low oxygen is available to your cells. Low oxygen is available to the cells. That is hypoxia. What are the causes of hypoxia? What are the causes of hypoxia? The causes are, remember, like hash. There are four causes. First is hypoxic hypoxia. Second is A for anemic hypoxia, S for stagnant hypoxia, and last is the histotoxic hypoxia. So we'll see these has or the four causes of hypoxia. Why the oxygen is low to the cells? Why it is available in low amount? This is the animal which is having lungs. These are the lungs and these are the cells. And this is the blood. So in case of animal, if we start from the outside, in the air, 21% oxygen is present. That oxygen enter the lungs. From the lungs, it will diffuse into the blood. This blood is having, if I draw the blood like this, it is having RBC. It is having RBC, in which oxygen combine with the hemoglobin and it will form oxyhemoglobin that will carry the oxygen. Suppose this is the cell. This is the cell. So from the air, the oxygen will reaches up to the level of cell. So in this path, if there is any disease or deficiency that may lead to low oxygen reaching to the cell. So first we'll start with the air itself. So number one is hypoxic hypoxia. It means the oxygen which is reaching to the lungs is less. Reason is air. Air is having less oxygen. That mainly occur in high altitude. High altitude. The second reason is air is having full oxygen, but these airways are obstructed. Obstructed airways. Example, COPD, obstructive diseases. These are having obstruction. So because of these reasons, oxygen is not reaching up to the level of cells. So first is hypoxia. Oxygen may be less in the air, or these airways are obstructed. These airways are obstructed. Right? Suppose these are the lungs. This airway is obstructed. So the oxygen may be less in the air, example high altitude, or it is present in the air but this is obstructed in case of COPD. So less oxygen reach to the lungs, less to the blood and less to the cell. So this is hypoxia. The second reason of hypoxia is number two is air. It is containing full oxygen. There is no obstruction. Lungs are okay, but the problem is in the blood. Problem is in the RBC. That is anemic hypoxia. Anemia means less RBC mass. If RBC is less, hemoglobin is less. That may lead to less oxyhemoglobin, and less oxygen will reach to the cell. So anemia is seen in case of pyometra, like, and in case of babesia, in case of trypanosoma infection, and many others. So RBC are less in number because of hemolytic anemia. There is less RBC, so less hemoglobin and less oxyhemoglobin. So oxygen reaching at cell will be less. This is anemic hypoxia. The second reason is altered hemoglobin. For example, in case of ruminant, there is nitrate poisoning. Nitrate poisoning. In case of nitrate poisoning, hemoglobin which is containing Fe plus 2 convert into Fe plus 3. And this is called methemoglobin. This altered hemoglobin, methemoglobin, cannot transport oxygen. So, number one problem is less hemoglobin or less RBC due to any infection, Babesia anaplasma. Second is altered hemoglobin. That is hemoglobin in case of nitrate poisoning, which is carrying +3 oxidized iron. It cannot transport oxygen. So less oxygen reach to the cell. Third is carbon monoxide poisoning, which combine with the hemoglobin, so it will form COHP. So less oxygen reach to the cell means hypoxia. And hypoxia is because of these conditions. It is called anemic hypoxia. As the trick was hash, this air is okay, the pathway is okay, and there is no anemia. It is having good RBC. It is having good RBC. But the third problem is with the flow. The third problem is the stagnant hypoxia. Stagnant means there is reduced flow of blood. This reduced flow, if it occurs at the artery level, we call it ischemia. If it is at the level of vein, it is called congestion. It is called congestion. Ischemia is the more common cause, more common cause of stagnant hypoxia. So in stagnant hypoxia, this blood which is flowing, it is having reduced flow. The perfusion is not good. At artery level, ischemia; if it is at venous level, called congestion. But this is more common. The next hypoxia, which is from the formula H, number 4. This is at the level of cell or tissue itself, so called histotoxic. Histotoxic hypoxia means problem is with the cell itself. Air is having full oxygen, no obstruction, lungs are okay, flow is good, all hemoglobin is normal, but the cell is oxygen is delivered here, but this is unable to use because there is cyanide poisoning. In case of cyanide poisoning, it inhibits cytochrome oxidase. Therefore, it will not able to utilize the oxygen. And in cyanide poisoning, blood becomes cherry red in color because this blood is filled with oxygen. Lot of oxygen is there, but cells are unable to use because the enzyme which is using oxygen is blocked by the cyanide poisoning. So there are mainly 4 types of hypoxia. We start with HASH, hash. This is the pathway and this is the blood and this is the cell. First problem is at the level of air or at the level of this airways or lungs. That was the hypoxic. Uh, that was the hypoxic hypoxia. Number two was air is having full oxygen. These airways are okay. Diffusion is good, but it is having anemic hypoxia, that is having less hemoglobin or altered hemoglobin, like met hemoglobin in nitrate poisoning in ruminant. Third may be air is okay, pathways, airways are normal, diffusion is good, hemoglobin is normal, but flow is not good. So, stagnant hypoxia. And this flow may be at the level of artery or vein. That is ischemia. And this is congestion. Number four, all routes are okay, it is diffused, but cell is not able to utilize. So problem with the cell. So histotoxic hypoxia. So four type of hypoxia has hypoxia. Out of these four, most common cause of hypoxia is ischemia. Most common cause of hypoxia is ischemia. Means the problem related with the flow. If we compare all the four, this is the cell or any tissue, then this is the arterial supply and this is the venous supply. Veins. The main reason that is ischemia. From the arterial side, oxygen is not coming. Oxygen is not coming. So problem with the flow. So the most common cause of hypoxia out of that hash is the ischemia. Is the ischemia. Blood is not coming to the tissues. Blood is not coming. Maybe in the blood vessel there is atherosclerosis or some narrowing of the vessels, but blood is not coming from the arterial side. So they are not getting oxygen. So there is hypoxia. So arterial blood is not coming here. So ischemia. Now question is, which is more dangerous? Hypoxia or ischemia? Which is more dangerous, hypoxia or ischemia? To solve this question, we'll see this is the cell which is taking oxygen and normally it is doing aerobic respiration. Aerobic respiration and lot of ATP. ATP. In case of hypoxia, this is the cell, it is getting less oxygen. So if it is getting less oxygen, there will be anaerobic respiration. That is known as glycolysis. So in glycolysis, we will get less ATP. But what happens in case of ischemia? This is the blood. This is the blood flow is not coming to the cell. And we know blood is a source of glucose, oxygen, and it is also taking waste product away from the cells. So in case of ischemia, here glycolysis is there, but if blood is not coming, ischemia is there, then there will be no glucose. No glucose means there will be no glycolysis. No glycolysis. No glycolysis means no ATP. These cells will die faster than hypoxic cell. So ischemia is more dangerous than hypoxia. Ischemia is more dangerous than hypoxia. Suppose this is the heart and this is the cardiac output or blood supply coming or it is taking. This blood is carrying oxygen and glucose. If there is some obstruction, that is called ischemia. That is called ischemia. So to this cell, no oxygen is coming, no glucose is coming. So this cell will not able to perform its glycolysis. Therefore, no ATP plus whatever toxic products which are synthesized by this cell, they are not going to the blood, so they are also accumulate. So because of these three reasons, no substrate, no oxygen, and accumulated product, this cell will die faster than the cell which is getting less oxygen and continuing its glycolysis. So the end result is this was the normal cell. If you give stress, then it will adapt. If you give some injurious stimuli, then there will be cell injury. Or if unable to adapt, cell injury. This injurious stimuli out of that, most common cause is the hypoxia. Most common cause is the hypoxia. And this hypoxia is of hypoxia. It was SH. Hash. Out of these four, most common cause is ischemia. So if a cell getting hypoxia or ischemia, this cell will die at a faster than the hypoxic cell. So where we have reached at cell injury. If this cell is mild and it is transient, temporary, then This is reversible cell injury. Cell injury. Why this cell injury occur? It occur because of the and if it is severe and progressive, that is, it may lead to irreversible injury, and that may lead to cell. What happens after cell death? After the cell dies, some morphological changes, and these morphological changes are known as necrosis and apoptosis. Common cause of cell injury is hypoxia, that is get less oxygen. Why? Because of those four reasons. If the cell injury is mild and transient, it is called a reversible cell injury. And if it is severe, it is called irreversible, and that may lead to cell death. This reversible may return back to towards normal. The condition is if you remove the but this irreversible cell after 12 hours of the cell death, morphological changes, and they may be necrosis and apoptosis. So in next lecture, we'll see if the because of hypoxia, if or transient, then what will happen? Then reversible injury will be there. In this, we'll see the swelling, hydropic disease. These we'll discuss in next. So if we look at the cell injury, changes of the cell injury, how this cell injury, how it is going? It is started at biochemical or molecular level. Then electron microscopic, ultrastructural changes. Then changes come at light microscope, and at they are visible grossly. Gross changes. So in case in pathology, for every cell will ultrastructural, what happens what happen in grossly. For example, there is necrosis. So in coagulative necrosis, there is injury. Suppose this cell injury is your coagulative necrosis. So in coagulative necrosis, we'll discuss ultrastructural changes, light microscopic changes. What are the gross changes seen?